of rotation, back resistance to the flow of fluid in the semicircular duct and past the bent cupola causes the endolymph to begin rotating as rapidly as the semicircular canal itself. Then, in another 5 to 20 seconds, the cupola slowly returns to its resting position in the middle of ampulla because of its own elastic recoil. When the rotation suddenly stops, exactly opposite effects they take place. The endolymph continues to rotate while the semicircular ducts they stop. This time the cupola bends in the opposite direction, causing the hair cell to stop discharging entirely. After another few seconds, the endolymph stops moving and cupola gradually returns to its resting position, thus allowing hair cell discharge to return to its normal tonic level. Thus, the semicircular duct transmits a signal of one polarity when the head begins to rotate and of opposite polarity when it stops rotating. Predictive function of the semicircular duct system in the maintenance of equilibrium. Because the semicircular ducts, they do not detect that the body is off balance in the forward direction, in the side direction, or in the backward direction, one might ask. Now, what is the semicircular duct's function in the maintenance of equilibrium? All they detect is that the person's head is beginning or stopping to rotate in one direction or another. The function of the semicircular ducts is not to maintain the static equilibrium or to maintain equilibrium during steady directional or rotational movements. Loss of function of the semicircular ducts does cause a person to have poor equilibrium when attempting to perform rapid, intricate changing body movements. You can see the function of the semicircular ducts can be explained by the following. That is, if a person is running forward rapidly and then suddenly begins to turn to one side, he or she will fall off balance a fraction of a second later unless appropriate corrections are being made ahead of time. But the maculae of the utricle and sicule cannot detect that he or she is off balance until after this has occurred. The semicircular ducts will have already detected that person is turning, and this information can easily apprise the central nervous system of the fact that the person will fall off balance within the next fraction of a second or so unless some anticipatory correction is made. In other words, the semicircular duct mechanism predicts that disequilibrium is going to occur and thereby causes the equilibrium centers to make appropriate anticipatory preventive adjustments. This helps the person correct balance before the situation can be corrected. Removal of the flocculonodular lobes of the cerebellum prevents normal detection of the semicircular duct signals, but has less effect on detecting macular signals. It is especially interesting that the cerebellum serves as a predictive organ for most rapid movements of the body as well as for those having to do with equilibrium. Vestibular mechanisms, they are there for stabilizing the eyes. When a person changes his or her direction of movement rapidly or even leans the head sideways, forward or backward, it would be impossible to maintain a stable image on the retinas until the person had some automatic control mechanism to stabilize the direction of the eye's gaze. In addition, the eyes would be of little use in detecting an image unless they remained fixed on each object long enough to gain a clear image. Fortunately, each time the head is suddenly rotated, signals from the semicircular ducts cause the eyes to rotate in a direction opposite and equal to the rotation of the head. This results from reflexes transmitted through the vestibular nuclei and the medial longitudinal fasciculars to the ocular. There is presence of some other factors concerning with that of equilibrium task. And what are they? They are the neck proprioceptors. The vestibular apparatus detects the orientation and movement only of the head. Therefore, it is essential that the nervous centers also receive appropriate information about the orientation of the head with respect to the body. This information is transmitted from the proprioceptors of the neck and body directly to the vestibular and reticular nuclei in the brain stem and indirectly by way of cerebellum. Among the most important proprioceptive information needed for the maintenance of equilibrium is that transmitted by joint receptors of the neck. Now, when the head is leaned in one direction by bending the neck, impulses from the neck proprioceptors keep the signals originating in the vestibular apparatus from giving the person a sense of disequilibrium. When the entire body leans in one direction, the impulses from vestibular apparatus, they are not opposed by signals from the neck proprioceptors. Therefore, in this case, the person does perceive a change in equilibrium status of the entire body. Now, proprioceptive and exteroceptive information from the other parts of the body. Proprioceptive information from parts of the body other than the neck is also important in the maintenance of equilibrium. For instance, pressure sensations from the foot pads tell one whether weight is distributed equally between the 2 feet and whether the weight on the feet is more forward or backward. Exteroceptive information is especially necessary for the maintenance of equilibrium when a person is running. The air pressure against the front of the body signals that a force is opposing the body in a direction different from that caused by gravitational pull. As a result, the person leans forward to oppose this. Importance of visual information in the maintenance of equilibrium. After the destruction of the vestibular apparatus and even after loss of most proprioceptive information from the body, a person can still use the visual mechanisms reasonably effectively for maintaining equilibrium. Even a slight linear or rotational movement of the body instantaneously shifts the visual images on the retina, and this information is relayed to the equilibrium centers. Some people with bilateral destruction of the vestibular apparatus have almost normal equilibrium as long as their eyes are open and all motions they are performed slowly. But when moving rapidly or when the eyes they are closed, the equilibrium sense that is immediately lost. The otolith organ. The otolith organ are responded or they are represented by the utricle and the circle. Together they are known as otolith organ. because the structures termed otolith are present in these regions of membranous labyrinth. The sensory organ in saccule as well as in the utricle are termed as the macula. The macula is also called otolith apparatus. The cupula of the macula contains many chalky six-sized prism-like particles of calcium carbonate which are called the otoliths, also called statoconia, otoconia, and ear dust. Neuronal connections of the vestibular apparatus with that of the central nervous system. Most of the vestibular nerve fibers that terminate in the brainstem in the vestibular nuclei, which are located approximately at the junction of medulla and pons. Some fibers they pass directly to brainstem reticular nuclei without synapsing, and also to the cerebellar, fastigial, uvular, and flocculonodular lobe nuclei. You can see the primary pathway for the equilibrium reflexes begins in the vestibular nerves, where the nerves are excited by the vestibular apparatus. The pathway then passes to the vestibular nuclei and cerebellum. Next signals are sent into the reticular nuclei of the brainstem as well as down the spinal cord by way of the vestibulospinal and reticulospinal tracts. The signals to the cord control the interplay between the facilitation and inhibition of the many anti-gravity muscles, thus automatically controlling equilibrium. The flocculonodular lobes of the cerebellum are especially concerned with dynamic equilibrium signals from the semicircular ducts. In fact, destruction of these lobes results in almost exactly the same clinical symptoms as the destruction of the semicircular ducts themselves. That is, severe injury to either the lobes or the ducts causes loss of dynamic equilibrium during rapid changes in direction of motion, but does not seriously disturb equilibrium under static conditions. It is believed that the uvula of the cerebellum plays a similar important role in static equilibrium. Motion sickness. It is actually a condition which is leading to one of the pathophysiologies which is seen with that of the system of equilibrium, and is a condition in which a person suffers from nausea, vomiting, pallor, sweating. There is presence of changes in blood pressure when that person is traveling in a moving object, and the moving object can be a car, a ship, or an aeroplane. Now this results when the car or ship changes its speed so that the angular acceleration or the deceleration of head is taking place with that of rest of the body. These effects are mediated by reflexes probably involving the vestibular connections in the brainstem and the flocculonodular lobe of cerebellum. So this is all about the vestibular apparatus, about the mechanism of equilibrium, what is this membranous labyrinth composed of, what are the function of different components which are making this, what is organ of otolith, and what is this motion sickness condition. So this is all about this system, and we are done with the system of central nervous system now. And God bless you all. Thank you very much. Allah Hafiz.